This is the lower leg now of a left leg. You can see the tibia and the fibula. So the tibia is the more medial shin bone and the fibula is more lateral. And up here is the patella. So the patella is slightly triangular. So we call this part the base, and the pointy part is the apex. And on the back, there's two articular surfaces called the medial and lateral articular surface. So the tibia, the proximal end is very broad, the distal end's a little narrower. At proximal ends, we call this the medial and lateral condyle. So this is obviously the lateral condyle, the medial condyle, and then we call this the shaft. And along the shaft, there's a very sharp anterior border, and that is the proper name for it. The medial border, which you can feel just under your skin, doesn't have much muscle mass over it, whereas the lateral surface, or the interosseous border, is a very sharp raised line, and that's because several muscles have their origin here. And then the posterior surface is very smooth. So what we can notice about the tibia is there's a large tuberosity here called the tibial tuberosity, and that's where the patella tendon inserts. So the quadriceps femoral group come over the patella or attach partially and then continue on to insert on the tibial tuberosity. And then there's another little feature here called Gerdy's tubercle. Gerdy's tubercle is where the iliotibial band inserts, which is down the lateral side of your knee. Down at the distal end then, this part that extends more inferior than the rest of the tibia is called the medial malleolus. And on the back of the medial malleolus is a small groove for the posterior tibial tendon. There are several articular surfaces to the tibia. So obviously at this end, this articular surface here is nice and smooth, and that's because it meets with the talus or the talar dome. And then here, there's two more articular surfaces, and we call these the plateaus. So this is the lateral tibial plateau and the medial tibial plateau. And in between, you can see something that seems preeminent. It seems to stick up. And that is your intercondylar eminence. So the intercondylar eminence, you can see, has two little tubercles on it. And these tubercles form important attachment sites for the cruciate ligaments, which are internal stabilizers of the knee joint. So very important ligaments, those cruciate ligaments. Now the tibia, you can see, has two connection points with the fibula. We often refer to this distal joint as the tibiofibular syndesmosis, which is a very complex joint. It's obviously a bony joint, but it involves several ligaments to help stabilize, and again another joint at the top between the tibia and the fibula. Now if we look at the posterior surface of the tibia, you can see there's lots of muscle origins. There's a very prominent line here called the soleal line, and I won't go into these muscle origins insertions too much, but this is where the popliteus muscle inserts, and then you have tibialis posterior and flexor digitorum longus. You can see how large those muscle origins are. But that's the tibia. So you'll need to know the tibial tuberosity, the medial and lateral condyles, the plateaus, which are these articular surfaces, these two little intercondylar tubercles for your cruciate ligaments, and most importantly, the medial malleolus, because it's a site of fractures and it's very common, and it's also the point where the deltoid ligament has its origin.